Reversing CHF, congestive heart failure. I'm Dr. Stephen Smith, an integrated medicine physician. I have 30 years of experience helping chronically ill patients restore their health through functional medicine techniques. CHF, congestive heart failure, is a chronic illness that may respond to functional medicine techniques, depending on the stage. First, a little background. CHF is a very common disorder. Over 5 million Americans have CHF. There are also 550,000 new cases every year. What is CHF and what causes CHF? CHF has many causes: high blood pressure, statin drug use, congenital heart disease, heart valve dysfunction, etc. One common trait of all these causes is the heart has to work harder to pump blood. With hypertension, high blood pressure, the heart has to pump against a higher pressure. When the heart valves malfunction, the heart also has to work harder to pump blood to the body. The end result is the heart gets bigger due to increased load. You would think this might be a good thing, but no, when the heart enlarges, the shape changes. The heart loses its optimal size and pumping efficiency. This in turn requires the heart to have to pump even harder. See how this becomes a downward spiral? The heart is one of the most energy-intensive organs in the body. The mitochondria in each cell produce the energy the heart needs. The number of mitochondria in a cell is proportionate to its energy needs. A skin cell may have only 200 mitochondria per cell, whereas a heart cell may have 5,000 mitochondria per cell. If there is a problem with the mitochondria, the heart has difficulty functioning due to lack of energy. The heart muscle loses power. The heart muscle also becomes flabby. The heart becomes enlarged and inefficient. Depending on the state of the disease, most of these changes are not reversible. The heart can also suffer from poor circulation due to vascular disease. Vascular disease is usually quite preventable and reversible. CHF is not reversible, but we can slow the process down. 1. Improve circulation with chelation therapy. We'll come back to chelation therapy later in the presentation. 2. Improve mitochondrial function. Mitochondrial DNA is not like our regular DNA. Mitochondrial DNA does not have the same ability to repair itself like regular DNA. It's important to protect our mitochondrial DNA. Statin drugs, which are supposed to protect our hearts, can damage our mitochondrial DNA. They do this by depleting CoQ10. CoQ10 is an important antioxidant that helps protect your mitochondrial DNA. A large study on the effect of statin drugs showed statin users had fewer heart attacks than the untreated group. But the untreated control group lived longer. Poor mitochondrial function may be the cause. There are ways to improve mitochondrial function. Improve the output of ATP produced by the mitochondria. Protect the mitochondrial DNA. Our body is powered by ATP, adenosine triphosphate. The heart needs a tremendous amount of ATP. The product ATP fuel is designed to help produce more ATP. ATP fuel helps the mitochondria produce ATP. It does this by supplying many of the intermediate steps in the production of ATP. ATP fuel is our most popular product because people get results with ATP fuel. But that's not all. We also recommend MitoSupport for additional support. MitoSupport both protects mitochondrial DNA and helps with energy production. L-carnitine, malic acid, ribose, and B vitamins help with energy production. CoQ10, alpha-lipoic acid, transresveratrol, and curcumin C3 complex help protect fragile mitochondrial DNA. The combination of MitoSupport and ATP fuel work synergistically to give maximum support to mitochondrial energy production. With more energy, the heart works better. CHF also requires standard medical support, medications to lower blood pressure, diuretics to reduce the fluid load. Combining standard medical treatment with mitochondrial support offers the best results. Some common questions. Will this protocol restore my heart to its normal size? No, but it may improve performance. Will this protocol eliminate the need for medication? No, most medications work mainly outside the heart to reduce the load on the heart. Our protocol helps the heart produce more energy in 3 ways. 1. ATP fuel for ATP energy production. Mitosupport for mitochondrial protection and energy production. 3. Chelation therapy to improve vascular flow. Chelation therapy. What is chelation therapy? Chelation comes from the Greek meaning claw. Chelating agents wrap themselves around heavy metal like a claw, so they can safely be removed from the body. IV chelation has been used for over 30 years to improve vascular flow. However, no large study had shown conclusively that it worked until recently. A large $30 million study sponsored by NIH showed that IV chelation was effective. The study looked at patients who had already had 1 heart attack. The question was, would chelation therapy reduce the chance of a second heart attack and death? The answer was yes. The study looked at diabetics and non-diabetics. Most of the benefit was seen in diabetics. There was a marked reduction in recurrent heart attacks, 52%, reduction in death rate from cardiovascular disease by 40%, a 43% reduction in death from any cause. How does chelation work? It's long been known that people with high lead levels have more heart attacks and vascular disease. Chelation works by removing lead from the body. This can be done by IV chelation or with oral chelation. To be clear, the NIH study did not address oral chelation. However, oral chelation uses the same main binding agent as IV chelation, EDTA. Dr. Gary Gordon, the father of chelation therapy, claims oral chelation is as effective as IV chelation. It just takes longer. So we have included oral chelation as the 3rd component of our CHF support plan. If you have CHF, then these supplements may improve your energy and quality of life. We have selected the best products for you. 1. ATP and fuel to improve the production of ATP. Mitosupport to protect and aid in energy production. 3. Cardiochelation to improve vascular flow, especially for diabetics. They can be purchased separately or saved when you buy everything you need in a bundle. You can choose a bundle with or without cardiochelation. Check out our bundles and save. Shop by condition at Agape Nutrition.